Hello, ladies and gentlemen. Best greetings from Kiel to California. I hope you have a very good, excellent conference and enjoy the nice weather you have in California. It's a contrast to Kiel, where we have right now constant rain and temperature far below the California temperature. We have about 10 to 12 degrees centigrade. I have to thank the organizer to give me the options to talk about the newest technology in managing soft tissue disorders and painful conditions. It's called the extracorporeal magnetotransduction therapy. I'm based in Kiel at the University of Kiel and running the orthopedic department. And my daily problem is focused on the normal key problems which we have in our orthopedic practice is dealing with pain. Pain due to inflammation, pain due to degeneration, pain after trauma, after surgery, and we try to optimize our regeneration processes to reduce soft tissue pain. The question is, if you start with a case like this case, for example, where you have a very active severe osteoarthritis of the ankle joint, how to deal with this pathology? For sure, you can put some total joint in it. You can put some injection into the joint. You make it bone preserving, or you make it as a bone joint replacement technology. If you ask the patients what options they would have, they mostly will make the choice to the non-surgical options. If you have the pathway of non-surgical strategies, you have three different options with chemical options like pharmacology, physical options, or biological options. Surgery, this is the last choice we should offer the patients. If you ask where the pain comes from, you should deal with, the pain doesn't come from the degeneration itself. The damaged cartilage gives you rarely pain, but the inflamed area, the inflamed soft tissue around the osteoarthritic joint gives a severe pain because we have such an insufficient repair mechanism for cartilage repair. We have ingrowth of the free nerve endings, unmyelinated C fibers, which goes along with the ingrowth of new vessels. It's because of the higher production of VEGF and other growth factors like NGF and the increased release of neurogenic active substances like substance P, for example, which leads to a new innervation of the painful area. At the end, the whole construct is known as the neurogenic inflammation. It's a soft tissue pathology. And if you have the options to reduce the neurogenic inflammation with a non-invasive procedure, it's an excellent option to deal with these painful conditions. And this is described by Fender just a couple of years ago, where I got this picture from. There are many pathways you should look for. Addressing the receptors, you can look for the reduction of the activation of tyrosine kinase A systems to decrease the activity of the receptors, of the bradykinin receptors, the capsaicin receptors, or just the prostaglandin E pathways. As you see in the slide, there are many, many different receptors. They all inducing painful conditions. If you have the inactivated receptor and you have the pain incomes increased, you should cut the income by decreasing the activity, for example, for the receptors. At the end, we're looking for an options to interact directly with the enzymatic reaction of the local neurogenic inflammation. And electromagnetic fields or impulses as released by the electromagnetic transmission or transduction therapy, EMTT, you have an options to interact directly with these local inflammation reactions. Rogers found 2009 you have to reach a specific energy level if you apply magnetic fields, and this level is defined or was found at around 10 millitesla, for example. But the threshold and the intensity itself is one part which is needed to induce biological reactions. It's all based on the Maxwell equation, which say that changing magnetic fields are creating electric fields. Vice versa, you can use electric fields to produce magnetic fields. And these electric fields you can induce by magnetotransduction. They can work by influencing the cellular systems such as membranes, transport proteins, channel system via electroporation, or also by piezoelectric effects. Maxwell says also that to induce local voltages or electric fields, you need very fast, increasing, strong, rapid magnetic fields. If you have a very strong magnetic field, which is appearing very slow and rise up very slow, like an MRI, for example, with 3 or 4 Tesla, you cannot induce biological reactions. If you have a smaller device with a lower magnetic field, but very fast rising magnetic fields with high oscillations, then you have a very high effective transduction power. And the threshold for magnetic transduction power to be effective was found at more than 60 kilotesla per second. You have to know that slow increase of magnetic fields do not create any clinical effects. There's a difference between EMTT or PEMF, pulse electromagnetic field devices. They are also in the market. The difference between the standard PEMF devices and the EMTT devices are pretty clear to describe. The frequency, the amplitude, and the speed of the increase. As fast as the increase is, as much voltage you can create. As higher as the amplitude is, as high the voltage is. As high the frequency is, as much voltage can be produced. And you have to have the release of at least 60 kilotesla per second as an effective transduction power. And normally, if you jump over, then the treatment is called EMTT. Everything below is called pulse electromagnetic field therapy. The idea of using EMTT is to have a wireless, touch-free, inductive charging or recharging of the local biological structures. All these energy-consuming processes need energy, and the energy can be provided touch-free on an inductive technique like EMTT. This is the this graph shows the blue line, the high oscillation of a couple of EMTT impulses versus the red line, which is symbolized the standard PEMF impulse. This is a single impulse of a PEMF device, and this here is a single impulse of an EMTT device. And you have a couple of impulse, and they all are very effective because high frequency, very fast increasing design, and a high frequency here. The difference between PEMF and EMTT is pretty clear. High oscillation, fast speed, increasing time, and at least the absolute strength or power of the EMTT devices are around 40% stronger than any PEMF device available in the market. This film shows you left side EMTT, right side PEMF device. You see the difference in oscillation and speed of the appearance of a single impulse. And the EMTT impulse, the couples of these impulses, about 20 to 30 impulses per impulse is a couplet. Only half of the PEMF impulse has passed the tissue. You see very slow acting magnetic fields. They don't produce any biological reactions. That's the difference. If you're creating these very fast oscillating impulses, you can induce electroporation. Electroporation means just a mechanical, anatomical change of the membranes, transport channels, and properties of cell membranes and cellular levels. These effects, mostly reversible electroporation effects, they change the porous structures of the membranes that allows larger molecules such as nucleic acids or even DNA to pass through the hydrophobic bilayer core. And even charged molecules can cross over the hydrophobic bilayer area, such as the cell membrane. And this is very important because you change complete the behavior that has a direct effect on the intracellular homogeneity and concentration. And you see in these pictures that if you change the properties of cell membranes and structures, even mitochondrial structures are changed. You have a change of the influx or exflux of structured higher molecules. They can pass the membrane right now, and you change everything inside the cell and outside the cell. That's how electroporation works. The second way how it works is piezoelectricity. If you have collagen structures or structures like long DNAs and proteins or cytoskeletons, if you put some mechanical stress on it, they're producing local piezoelectricity. Vice versa, if you apply electricity on these structures, you can induce mechanical transduced effects. You have, it is shown by many studies right now, you have mechanosensitive structures like opening gate structures, channel proteins. They are sensitive to piezoelectricity. So EMTT works via electroporation and via piezoelectricity. Parpate showed it in 2017 how much effect piezoelectricity has on cell main structures on all these energy demanding processes. So EMTT provides a high concentration of ATP. It has a direct influence on the energetic balance of the energy consuming structures. With this knowledge, I get the machines from companies to look for the effects on the cellular level. In our large basic research laboratories, we harvested the MSCs from our human bones, which we harvested during surgery. We culture these cell lines and we expose these cell lines to EMTT impulses. And we look for the biological activity and look for the expression of certain markers such as collagen 1, alkalic phosphatase, osteocalcine, VEGF, and BMP2. And we found a significant difference in all these markers and expression of these markers via the PCR technology in comparison to placebo 14 days after application of EMTT. And we are surprised that all these procedures and releases of all these molecules and biological active structures were activated. Higher increase of the expression of all these substances means it works globally. It's a little bit like you push on energy on these structures, You release the energy which is required for these energy demanding processes. With these findings, we go for the ED committee and ask to use the machines for clinical use. And I did it firstly by myself. I do a lot of triathlon competition, mostly on Sunday. On the Monday, when I go back to my office, it's hard for me to just walk on stairs. So painful musculoskeletal fatigue pain I have. And I put the EMTT application on one leg, randomly on one leg, next time randomly on the other leg. And I look for the time interval when I was able to walk pain-free. In all 6 trials or tests, the treated side works better, at least 2 days faster than the untreated side, 6 times by myself. It's not a prospective randomized controlled trial, but it shows clinically it works. And with this impression and the data we have had from our basic research laboratories, we offer it to our standard orthopedic cases, like patients suffering from shoulder pain, hip and knee pain because of osteoarthritis, heel pain, non-unions, bone disorders, skin disorders, radicopathies, all the stuff. And we asked 6 weeks after last treatment, are you happy with the treatment or not? And only 17 out of 117 will not repeat because they have not found any response. But 125 out of 168 will repeat the treatment because they have had positive response due to the EMTT application. And then we offer it to our professional football players. 28 got the treatment, all suffering from soft tissue injuries after competition or after the games, and all but one returned back to normal regular sports level. This is very impressive. And we offered EMTT as an additional treatment to all these conservative options we are used to use. This is one case, for example, an athlete, a professional next-gen football player or soccer player suffering from a severe disease, very painful. And as you know, it's hardly to treat these kids very successfully without reducing weight bearing, without taking scratches for a while, inserts, modification, ice, cooling sprays, all the stuff, but they cannot play anymore because it's too painful. And it's hard to bring them back to normal, regular activity levels. In these cases, we did all these options we have, and we offered additionally EMTT. And the protocol says 8 times, means twice a week, with 80 millitesla application energy level. And you see, just by modifying the training, they all come back to the regular competition level within 6 weeks, suffering from an osteoarthritis, osteochondritis of the heel, for example. And it works also in bone pathology, such as stress fractures. 14 years old, elite soccer player, suffering 10 months of painful lower limb pain, 8 weeks of casting, partial weight bearing, all the time physio, but still a lot of pain. And we haven't changed the protocol of treatment, but we offered additionally EMTT. You see 8 times 20 minutes treatment, 80 millitesla application level, 2 times a week. And within the time frame of 10 weeks, you see that the bony structures shows bridging and the patient is pain-free and returns to the same team level as he played before. This is very successful in the patients, and even the parents. The parents are pretty happy to get the son back to normal, regular level. And it works in different locations. It works in all stress fractures in the foot, heel, midfoot pain, for example. And another indication is bone edema. This is the inertial, it's a fasciitis. And you see the secondary bone edema, which goes along the insertion area of the fascia. Maybe the fascia is not that painful, but the bone edema gives you severe weight-bearing pain. Patient got treatment 8 times, 2 times a week, 80 milliTesla per application, energy level, and it works. And thanks to Martin Ringeisen, he is focused in his office on bone edema. He's collecting many, many cases, and he did the treatment in 34 cases and did the analysis. You see pain score is 6.5 prior treatment and 1.4 6 weeks after last treatment. And maybe all of them go back to regular level. Just a little bit pain is left after 6 weeks. And the patient communication is pretty good using the social media. And then we have professional regular soccer players. They're looking for the offices where we offer EMTT, and they're looking for the treatment. They're pretty happy. Right after the game on Monday, they approaching the office, say, okay, very painful contact I have had, a lot of knee pain or foot pain. Give me the EMTT, and it works as a pain treatment. Together with Amol Saxena from California, Brian Fulham from Florida, we did a study offering EMTT for Achilles tendinopathy. And the patient got conservative treatment, and the treatment group got conservative treatment plus EMTT. And we looked 12 weeks after last treatment on the change from baseline on the VAS score system in 53 cases. They all got the treatment in accordance to the normal regular guidelines. And you see on the right side, the 12 weeks control in comparison to the 12 weeks EMTT control, that the difference is statistically significant in favor for the group getting EMTT. Then we're looking for more indications, and this is a case with nearby 3 years of non-union after trauma. In nailing, you see the persistent open non-union, painful condition, and then they got the treatment EMTT, and see 6 weeks after it starts bridging, you see the non-union is disappearing slowly, the pain is gone, full weight bearing possible without using crutches. Very impressive to get these as an old female happy within 6 weeks after 3 years of complaining pain. And it works also in all these painful soft tissue conditions, which you know after ankle sprain, for example, swelling, painful on full weight bearing. And as a standard of care right now, we're offering all these braces, inserts, and all the stuff, but we offer the combination with EMTT 8 times, means 2 times a week, 4 weeks treatment, 80 milliTesla application level. You know all these options of bracing, castings, insert, and all the stuff. And we combine it right now after ankle sprain, and it works pretty good. Finally, this is a prospective randomized placebo-controlled trials in patients suffering from active osteoarthritis of the knee that were scheduled for surgery, and we offered EMTT as an option. And you know the protocol, same protocol. In 12 weeks after last treatment, we did the analysis, and you found significant improvement after EMTT in comparison to control. In nearly all of these cases, getting successful treatment, they scheduled surgery. They say, I'm happy with the treatment, I want to make surgery later on. This is very impressive. You see how it acts, and the patient would be very happy to get this non-invasive, touch-free method for pain management or soft tissue management. And finally, this question, can we optimize these options in soft tissue engineering? Combining EMTT together with, for example, shockwave treatment. And Tim Klüter from our university did a prospective randomized controlled trial in cases suffering from an insertional tendinopathy of the shoulder, 86 cases, and half of them get the shockwave treatment, the other half of them get shockwave treatment plus EMTT. And we look for the outcome 24 weeks after last treatment. There's a protocol of shockwave treatments, 3 times higher energetic, focused application. and the EMTT group got the same shockwave treatment plus EMTT. And you see, up to 20 weeks after last treatment, the difference is statistically significant in favor for the combination of shockwave plus EMTT, which is shown at the black graphs right here, the black lines showing the combination, and the red one, shockwave treatment only. And the difference is about 15% difference in favor for the active group. It was shown in the VS score as well in the Constant-Murley score. And I think that's the future. Future means you should combine different complex, powerful options in treating patients suffering from soft tissue pain. Soft tissue pain after trauma, after surgery, or even in degeneration. And EMTT works because it interacts directly, touch-free, wireless-free, in bone healing, implant integration, rehab, inflammation after trauma and after surgery, and also in bioregeneration options. And furthermore, I think EMTT is a good option to improve soft tissue environment in reconstructive options by using scaffolds, for example, bone transplant or cartilage transplantation technologies. You improve the properties, the biological properties. So what else is needed? I think you should look for a strategic alliance combination of different options you have. Finally, also the combination of EMTT plus surgeries and options. As we know in our foot department right now, they're offering EMTT in all cases after surgery. And the time from painful condition to pain-free full weight bearing can be shortened by using EMTT because you have a direct effect on the neurogenic inflammation post-trauma process of all these painful conditions. I can end my talk with a simple statement saying that your body's ability to heal is much greater than anyone has permitted you to believe. And I want to send best greets from Kiel University to California, and hopefully you enjoy the meeting, and send best regards to Kiel. Bye-bye.